All right. Today, let's learn about HIV/AIDS, the sneaky retrovirus. HIV is a virus of the genus lentivirus under the umbrella of a retrovirus. And what exactly is a virus, might you ask? A virus is a non cellular pathogen which cannot replicate without a host. Here's a picture of HIV under the microscope. Now, let's explore the life cycle of HIV. So, once HIV enters its host, it finds its way into the immune system where it begins to replicate and continue to do so until its host dies. We'll go more into detail with that later on. HIV mainly affects humans and certain primates. Okay, how does it spread? HIV is a bloodborne pathogen. If any part of your mucus layer is exposed to HIV infected bodily fluids, then you're at high risk of infection. Risky behavior that expose you to HIV include unprotected sex, sharing needles, and coming into contact with contaminated blood, along with all the things listed on this slide. Okay, now let's talk about the infection process. So, again, HIV is a bloodborne pathogen. Once HIV enters into the bloodstream, HIV binds to the CD4 receptors in your T helper cells, which is part of your immune system, as you can see here on the left. Okay, this is a more detailed version of it. So HIV has a single strand. So you can see at the top right there, the CD4 receptor binding to the HIV. HIV has a single strand of RNA, which forms into DNA once it's inside. HIV binds, HIV embeds itself into the nucleus of the T cell, and from the nucleus, it will create more copies of itself and spread like little minions. The T helper cell will continue producing HIV replicas until it dies. This will eventually cause you to have low T helper cells, which will hinder your ability to fight off opportunistic infections. If left untreated, this will lead to certain death as we need our immune system to survive. This is a map showing uh, all the HIV related deaths, HIV/AIDS related death around the world. As you can see, most of the deaths are coming from Southern Africa and parts of Asia. And mainly these are regions that are low on resources and don't have access to medications. So now let's learn a little bit about the history of HIV and how it came to be. So, um, HIV/AIDS was first suspected to exist. It was first suspected to exist in 5 young gay men that were otherwise healthy who passed away from an unusual pneumonia. This was reported by the CDC in 1981. There were clusters of gay men that were dying from opportunistic infections, and it was puzzling the doctors at the time. This was so unusual that the New York Times published a paper calling the newly discovered illness as a rare cancer found in homosexuals. It wasn't until 3 years later, in 1984, that Dr. Robert Gallo was able to isolate the cause of the AIDS illness. He discovered a retrovirus as the cause of the AIDS, which they named HTLV 3, or more commonly known today as HIV. Okay, the current statistics on HIV infections, according to the World Organization, there's an increase of the total number of people living with HIV from 2010 to 2022. The total number of infected rose from 31.5 million to 39 million. Even with all the efforts, even with everything we've been through with the disease, we are still failing in the overall spread of the disease, especially in countries with less resources. Now we can follow the symptomology of HIV. Uh, HIV infections are generally asymptomatic until years after the more severe recognizable symptoms appear many years after infection. Typically, 40 to 90% of cases, initial infection will cause a fever 2 to 6 weeks after infection. HIV infection is categorized in 4 stages and marked by symptomology. Stage 1 is asymptomatic. So you can see the guy's very relaxed. He doesn't know what's coming to him. Stage 2 is marked by weight loss, reoccurring respiratory infections. This is because your immune system is getting weaker, right? Because of the decrease in T cell count. Stage 3 is categorized by more weight loss, oral candida, so oral fungus, severe bacterial infections, unexplained fevers, and chronic diarrhea. Stage 4 is marked by pneumonia, cerebral toxoplasmosis, uh, the oral candida or the oral fungus is spread to the esophagus and the trachea, HIV encephalopathy, and many, many more. So, once infected with the HIV, the person will become a carrier and will continue to carry the virus for life. The good news is, with current medicine, your viral load can be so low that you can test negative for HIV. However, HIV is very challenging for virologists to cure because of the virus' latent ability, which we'll talk about later, among other things. The virus is able to stay dormant inside of a patient's T helper cells and replicate at a later stage. Therefore, even with a viral load at near zero, the virus can easily begin to replicate again and spread. These are the current medications that are available to HIV patients. Some of them you take once a day, and some of them are monthly injections. Examples of these are Biktarvy, Dovada, Genvoya, Complera, and Cabenuva, just to name a few. So this is HIV's latent ability. As you can see here, uh, the you can get rid of most of the HIV, but as soon as our therapy begins or stops, you can have the virus replicate again and spread. This is the latest innovation in trying to cure the disease. So um, they're looking into gene editing in order to eradicate the virus and are focusing more on a CAR T cell approach. A CAR T cell therapy focuses on altering the genome of the T helper cells in order to train them to seek out the virus and HIV infected cells and destroy them. Uh, tests are currently being, studies are currently being performed. Okay, any international efforts to eradicate the virus. We have the Global HIV Prevention Coalition, which was established in 2017 with the mission to eradicate HIV by 2030. The coalition is focused more on regions that are more vulnerable to the disease and provides strategies to help minimize the new infections. HIV/AIDS prevention includes educating the public, sex education, free access to HIV medicines and condoms, uh, promotion of safe sex, contact tracing, and diminishing the viral load in infected individuals. Now, the future and how can we protect ourselves? So, as you can see from this graph, HIV related deaths have declined very significantly throughout the time. However, infections have increased, or the number of infected have increased. So, the best way to protect yourself is to practice safe sex and stay away from coming into contact with somebody else's blood or bodily fluids. And if you want to fight against the disease, then just follow these steps, and one day we can finally eradicate it.